leads to This tends to lead to boys being born with low birth weight or being born prematurely, both of which are factors that could mediate the impact of maternal depression on later cognitive outcomes. So given these gaps in the literature, I wanted to understand and perform a meta-analysis on sex-specific estimates of the association between maternal depression and cognitive outcomes throughout childhood and adolescence. And so within this meta-analysis, our population of focus was mothers and their children less than 18 years old. We were focusing on children exposed to depression either in utero or in the postnatal period. And we focused specifically on observational studies with a prospective longitudinal design so that we could really establish the temporality of associations, ensuring that it was specifically maternal depression that was having a subsequent impact on children's later outcomes. And we kept our definition of children's cognitive development quite broad and included a variety of different measures. The search was conducted across a number of different databases, and we used the random effects meta-analysis to estimate the effect sizes of maternal depression on child outcomes. And we also assessed risk of bias, but I won't present that today for the sake of time. So overall, from about 9,000 initial studies identified, we were able to include 12 studies in our meta-analysis. And these articles use data from 8 unique data sets from a variety of countries. And you'll note here that only one study was from a middle-income country. And so we're just sort of seeing again that point that I made earlier, that the majority of research is being conducted in high-income countries. And there was also a wide range of sample sizes, but in most cases, there was about 50-50 representation of boys and girls. In terms of the measures of maternal depression and cognitive outcomes, we found quite a balance in terms of whether studies were using clinical or subclinical measures of maternal depression. However, there were only 2 studies that measured depression antenatally. So most of these findings are more specific to children being exposed to maternal depression in the postnatal period. And finally, a variety of cognitive assessments were used, including exam performance on academic tests and different executive functioning measures, but most studies used the Baileys. So when we meta-analyzed data from the 12 studies, we saw that maternal depression was significantly associated with cognitive outcomes in boys in a negative manner, which is what was expected. So we see here that most studies found that boys exposed to maternal depression had poorer cognitive outcomes compared to boys who weren't exposed to maternal depression. When we looked at the meta-analysis in girls, we found that this association was not significant. So we see here that for most of these studies, girls exposed to maternal depression did not have significantly worse cognitive outcomes compared to girls who weren't exposed to maternal depression. So if we come back to Goodman and Gottlieb's model, we find that child sex does function as a moderator of this association, even when considering other child outcomes, and particularly that boys appear to be more vulnerable to the effects of maternal depression in terms of their cognitive outcomes. Our next study sought to build on this by using a Canadian sample to not only explore sex differences, but also exploring the potential mediation in this association. And this work was also published in Psychological Medicine. So our starting point was what we just learned in the meta-analysis, that boys exposed to maternal depression are more likely to experience poorer cognitive outcomes than girls. We also knew from a number of studies within the field that factors within the home environment, specifically maternal parenting practices, mediate the association between maternal depression and children's academic performance. However, we know that as children age, they become less dependent on their parents, and modifiable factors outside of the home environment may come into play as mediators. And we were particularly interested in the school environment. And knowing that school engagement and peer victimization are formative aspects of the learning environment, and that these factors can be impacted by maternal depression. And so we really wanted to understand whether they could act as mediators in this association. So our overall objective was to examine the mediating role of school engagement and peer victimization in the association between maternal depression and children's academic performance. And given the sex differences that we'd found in the meta-analysis, we wanted to explore the moderating role of child sex, not only in the direct association, but also in the mediation pathways. So this work was done using data from the Quebec longitudinal study of child development, which is a birth cohort that's been following children born in late 97 and early 1998. And our analysis sample consisted of about 1,000 families, over 80% of whom were of Caucasian ethnicity. And most of these families, about 75%, also were from high socioeconomic status background. And finally, the prevalence of maternal depression in this sample was about 11%. So in this sample, research assistants visited participants' homes to assess maternal depressive symptoms using the Center for Epidemiological Studies depression scale at 4 different time points between children's ages of 5 months and 5 years. And so at each time point, mothers were asked, over the past 7 days, how often did you experience a variety of symptoms, specifically related to depression? And then when children were aged 6, 7, 8, and 10 years, information about their school engagement and peer victimization was assessed from various sources. So we asked children themselves and their teachers to report on children's level of different dimensions of school engagement at these ages. And then we asked parents, teachers, and children to report on the frequency of children being victimized by their peers over the past years. And then finally, for our outcome, we used data from a government exam that all children at the age of 12 take in the province of Quebec. And then to ensure that we were really capturing the associations between our variables of interest rather than any spurious associations, we controlled for a number of baseline characteristics at the child, mother, and family level that were assessed when children were 5 months old. And then finally, we used structural equation modeling, which, in simple terms, consist of multiple regressions between these different variables to better understand whether school engagement and peer victimization do explain the association between maternal depressive symptoms and their outcome of children's academic performance. So we found that in the overall sample, exam scores, I wanted to clarify, for exam scores, we had data on children's mathematics, reading, and writing exam scores, and the findings were consistent across these different outcomes. So for time's sake, I'm only focusing on mathematics scores in these results. So we found that mathematics scores were negatively associated with maternal depressive symptoms, which is what's expected based on previous findings. However, when we came to look at the mediation, we found, sorry, I think someone's microphone is on. If you could please turn your microphone off, that would be great. Thank you.
Can you turn off your microphones, please?
Thank you. So we found here that although children's academic performance, particularly boys' academic performance, was associated with different dimensions of school engagement, none of the mediators were associated with maternal depressive symptoms. So there was no mediation for boys. However, in girls, those exposed to maternal depressive symptoms were more likely to have poor school engagement, and this was consequently associated with their academic performance. So we found here that the mediation was significant in girls, but not in boys. So when we come back to Goodman and Gottlieb's model again, we were able to identify an additional mediator when considering the association between maternal depression and children's cognitive outcomes. And we also showed that child sex doesn't just moderate the direct association between our exposure and our outcome, but it also moderates the indirect associations such that this mediation is only significant in girls and not in boys. So in coming to our third study, we wanted to apply Goodman and Gottlieb's model to a different social and cultural context. And so we focused on maternal depression and young adults' mental health in the South African context. And this research was published in JAMA Network Open in 2021. So the starting point of this work was really looking at the significantly different rates of maternal depression in low and middle income countries compared to high income countries. And so we know that the burden is much heavier, but we don't really understand whether the impact of maternal depression is also heavier in low and middle income countries as compared to high income countries. We also know that adolescents and young adults exposed to maternal depression in childhood are more likely to experience internalizing symptoms such as depression and anxiety. And we know from research in high-income countries that a family's socioeconomic status may moderate this association. So specifically, previous studies that had been conducted in high-income countries showed that children from a low socioeconomic background and exposed to high levels of maternal depression are more likely to experience mental health problems later in life. So there's this interaction where being exposed to high levels of maternal depression and jointly also having exposure to low socioeconomic status then increases the risk of poor mental health outcomes later on in life. So this really aligns with the cumulative hypothesis that being exposed to more risks increases your risk of later life problems. But as I said before, we're not sure if this association plays out in different cultural contexts. And so we wanted to examine the moderating role of family socioeconomic status in the association of maternal depression with adolescent and young adult internalizing symptoms. And given the existence of sex differences when looking at cognitive outcomes, we also wanted to explore this moderation separately in males and females. And so to do this, we used data from the birth to 20 plus cohort, which is the longest running birth cohort in Africa. And it followed children born in and around Johannesburg in 1990, and they're still being followed up until this day. And for this sample, we had about 1,000 families, over 90% of whom were of Black African ethnicity, and about half of the sample were living in poverty, as indicated by a locally developed wealth index. And the prevalence of maternal depression in this sample was a bit higher than in our Canadian sample, so about 17% compared to 11% in the Canadian sample. So in terms of maternal depressive symptoms, we had mothers again self-report their experience of different depressive symptoms over the past week, according to the PIT inventory, when children were 6 months old. And then when children were 14, 22, and 28 years, they self-reported their own internalizing symptoms using a variety of different measures. And so we indicated cutoffs on each measure to distinguish those experiencing high versus low internalizing symptoms. So to sort of have some kind of consistency across these different measures. In terms of socioeconomic adversity or socioeconomic status, this was an index score created based on level of poverty, the level of parental education, parental age, and household crowding when children were 6 months old. And finally, we adjusted for different child level characteristics to ensure that we were properly capturing the association between maternal depressive symptoms and our outcome of self-reported internalizing symptoms. And we used group-based trajectory modeling, firstly, to estimate trajectories of internalizing symptoms, which I'll describe a little bit later on. And then we regressed these trajectories onto maternal depressive symptoms using logistic regression. So group-based trajectory modeling is a longitudinal model that enables us to track how a specific outcome changes or doesn't change over time. And so here we have on the x-axis participants' age, and on the y-axis, the probability of having elevated internalizing symptoms. So participants who had higher levels of internalizing symptoms at each age would be assigned to the high trajectory of internalizing symptoms over time. And this constituted about 11% of our sample. Whereas participants who tended to have lower scores of internalizing symptoms over time, the model assigned them to this low trajectory, which consisted of about 89% of our sample. And when we regressed this binary variable, so belonging to the high trajectory or not, onto maternal depressive symptoms, we had an adjusted odds ratio of about 1.2, suggesting that children exposed to maternal depressive symptoms had about a 1.2 higher odds of experiencing high trajectory of internalizing symptoms throughout adolescence and young adulthood. Then the next step was firstly testing the interaction between maternal depression and socioeconomic adversity and looking at this differently in males and females. So here we have on the x-axis the socioeconomic adversity index score. So the higher the score, the higher the socioeconomic adversity. And here we have the odds ratio of the association between maternal depressive symptoms and children's internalizing symptoms. So we see here that the odds of experiencing high internalizing symptoms when exposed to maternal depression is higher for females who have low socioeconomic adversity. So in other words, the better off female participants were, the more likely they were to experience high internalizing symptoms if their mothers were depressed, which is counterintuitive. Whereas for male participants, we see that the odds of experiencing high internalizing symptoms when exposed to maternal depression is higher when they're experiencing higher socioeconomic adversity. So this is more in line with the findings that we've seen in high-income countries, where being exposed to a socioeconomic adverse environment or low socioeconomic status and maternal depression increases the risk of experiencing internalizing symptoms later on. So again, this idea of cumulative risk, making it more likely that someone will experience internalizing problems later on. And although we didn't have the capacity to do this within this study, it would be very interesting to pursue qualitative research to better understand what are the differences in social and cultural practices around caring for male versus female participants that explains this differential interaction that we're witnessing here. So finally, if we come back again to Goodman and Gottlieb's model, we see that child sex moderates the association between maternal depression and children's mental health outcomes, but also that family SES is an additional moderator, and that there are interactions between these two different moderators and try to help us better understand how and for whom maternal depression impacts child outcomes. So now I'm just going to go over the results identified through the different studies and just highlight some discussion points that I hope we will be able to build on in the Q&A section. So the key message that I want you to take home from this talk is that there really is a need to expand existing theoretical models to consider how associations play out, not only with different outcomes, but in different social cultural contexts, especially considering that the majority of the world's children live in contexts that we really don't understand from a scientific or research perspective. And then specifically concerning Goodman and Gottlieb's model, the research that I presented today highlights key lessons learned and also highlights things that can be addressed in future research moving forward. So we found that child sex not only moderates the direct association between maternal depression and cognitive outcomes in high-income contexts, but it also moderates the indirect associations. But there's still questions that need to be addressed here, namely trying to understand what factors may mediate this association in boys compared to girls. And then when it comes to research done in South Africa, we found that family socioeconomic status interacts with child sex to moderate the association with mental health outcome in a middle-income country context. But as I said, there's still questions surrounding why we would witness this different association in boys versus girls. Is there a difference in how boys and girls are raised in these different contexts, or how much time they spend with their mothers? Or perhaps it could even involve the involvement of other caregivers in caring for young children, so that, you know, a young child might not be spending as much time with their mother and be less exposed to maternal depression. This might explain why we're seeing these differential associations. And then finally, I want to come back to this graph to really highlight the importance of trying to understand this early childhood environment, because we know that this environment has a big impact on later life outcomes. And so being able to better understand this environment can lead to preventive interventions that ensure that we're giving children the best possible start in life to thrive and succeed later on. I just want to acknowledge the contributions of my collaborators across different universities in this work, as well as the funding from the Vanier Graduate Scholarship, as well as the Marie Curie Scholarship from the EU in funding this work. I thank you very much for your time and look forward to discussing with you further.
So thank you very much, Dr. Ahun, for that wonderful presentation. please feel free to just unmute, and you can also write your questions in the chat. So as you were saying, is there a very sensitive age that affects either sex? Is it 1 to 5, or is there a very sensitive time that we should look at?
So the answer to that question depends on what you're looking at. If we're talking about brain development, broadly speaking, then the first 3 years of life particularly are very sensitive to environmental exposures, both positive and negative, because that's when, synapses are being formed, synapses are being pruned. And so the different exposures that children are exposed to can really have a stronger impact on the way their brain develops versus if they were exposed, at 6 or even 7 years of age. When it comes to maternal depression specifically, so one of the moderators in Goodman and Gottlieb's model is the timing of maternal depression. And so there hasn't been enough research done on this to give a conclusive answer. Some research suggests that children being exposed in the antenatal period, so during pregnancy, are more sensitive to maternal depression than children who are exposed in the postnatal period. But then when you look at work that focuses only on the postnatal period, for example, I did a study where we tried to compare whether children exposed in the first 3 years of life to maternal depression versus children exposed between 3 and 5 years had different outcomes. We didn't find an effect of timing. It was really the effect of being consistently exposed from birth to 5 years that led to poor outcomes. So the question of sensitivity really depends on which particular risk factor or protective factor that's being studied.
Thank you. There's a question in the chat. It says, thank you for the great presentation. Do we have work on paternal depression, also on the cognitive skills of children?
That is a great question. So in recent years, there has been more interest in trying to understand paternal depression and how it influences child outcomes. I will say the majority of research has focused on the impact of paternal depression on children's mental health outcomes and behavioral outcomes. There's a lot less understanding of how paternal depression impacts children's cognitive skills, and more so, whether there are any interactions between maternal depression and paternal depression, right? So if a child has only one parent that's depressed versus both parents that's depressed, that's going to impact how either parent is able to take care of themselves and how they're also able to take care of their child. So that's really a field that people are trying to move into now. But generally speaking, I would say that there isn't much evidence on how paternal depression influences children's cognitive skills. That's a great question. Thank you.
Yeah. Any other questions? So as you are presenting, since I'm in a grant writing mode, I was thinking, and I normally think rodents, and I was thinking, since trying to see how this phenomenon develops over time. And I was thinking, since in humans may be quite tough, is there where you maybe take a rodent like a mouse and maybe inject it with the mother with something like cortisol, and just to try to mimic the depression, maybe cortisol or norepinephrine, or maybe decrease the dopamine or things like that, and then follow that after birth, something like that?
So I'm not very familiar with rodent studies in depression. So I'm not sure how the neural mechanisms of it would work, but I can imagine that putting rats in a stressful situation or increasing their level of stress can be one way of trying to mimic maternal depression. And so observing, if you inject the rat during pregnancy with cortisol versus post-pregnancy, trying to test whether you see any differences in how the child rat is affected in terms of its behavior, that's definitely something I think that would be an interesting route to follow, but I'm not as familiar with the neurobiology of depression.
Okay.
I study it more from the psychosocial perspective. But that's a very interesting question.
Yeah. What about disease? Does it like osteoarthritis or all these other diseases? Cancer, are there relationship with depression and early?
Yeah, so there has been growing interest within the field of medicine to better understand how physical health and mental health are related. So I don't know about osteoarthritis specifically, but generally speaking, we know that individuals experiencing physical health problems tend to have higher levels of depression. Right. Because the experience of not being able to function as well on a daily basis, not being able to engage in the daily activities that they're used to, that can really affect somebody's mental health and their depression level. So we do know that people experiencing various physical health problems tend to have worse mental health problems. The caveat I would add to that is that most of this research tends to focus on older adults. Okay. So there isn't as much work trying to look at younger adults who are parents of young children and trying to see how those mechanisms work and function. But we do know that in older adults, there's the associations of varying strength, but that physical health does increase the risk of experiencing depression.
Okay. Any questions, Mike?
Yeah, actually, you kind of already answered it. It was more like for outcomes such as not the major diseases, but let's say colds, like your immunity and so on. I guess depression is related to that. So if that maternal depression had any effect on a child's immunity during early stages, I'm not sure what has been studied on that.
That is a great question. So because I don't study the neurobiology of depression specifically, I'm not as aware of the literature that focuses on maternal depression's impact on children's physical health problems. But I do know, I think there have been studies that have focused on children's sleep patterns and behavior in terms of exposure to maternal depression. But I think within that field, it's more applicable to antenatal maternal depression. So if the child is exposed to specific hormones or stressors in utero, that then influences how their brain develops, how their immune system develops, which could then increase the risk of problems later on. So, for example, if a child is born prematurely or with low birth weight, we know that children who are low birth weight and premature tend to have more health problems, and that being exposed to maternal depression can increase the risk of being born prematurely and with low birth weight. And so there are definitely links there, but it's a lot more specific to antenatal maternal depression.
Okay, as opposed to post. Yeah. Interesting.
Any other questions? So if there are no more questions, I would like to thank Dr. Ahun for that wonderful presentation. And thank you very much for talking to us. We look forward to seeing you at McGill next year. So thank you very much. And thank you everyone for attending the seminar. Thank you.
Thank you so very much.
Yeah, thanks again for coming.
Yeah,
Bye-bye.
Bye.
Take care.